it's...
Yeah, it's a simple injection. We do a few injections, but with each one injection, I'll do a discrete maybe 6 to 10 locations. So we start where there's the most pain, we inject there first, and then we go around that site to strengthen the adjacent ligaments. And then we'll bring the needle out, go in another place, and continue with the process. Immediately following, because the anaesthetic is in place, we have you go and do a test walk, and the way that you feel is, yes, it's because there's anaesthetic in there, but it actually gives you a very good preview of the final outcome. So I think psychologically it gives people a boost, because they imagine often, I'm going to have to live with this for the rest of my life, it's just never going to get any better. Well, if it's a musculoskeletal problem, you may not have to think that way any longer, but investigate prototherapy, take a look at it. Remember, if it doesn't work, it won't do any harm, and it is over 90% effective.
So this is people like tennis injuries with shoulders?
Rotator cuff, tennis elbow, golf elbow, sprained ankles.
Falling off bikes?
Yeah, any kind of fall where you've banged a joint, you've usually thinned the ligament, and so it heals. Ligaments always heal, but they just don't heal as strong as they should be. So essentially what happens is the joints become a little slack because the ligaments are weak or lax or stretched, and it's that extra movement in the joint that's causing the problem. When we strengthen those ligaments, we tighten the joint. So now the joint can go through its normal range of motion under stress, under musculoskeletal pressure, and it won't hurt. It'll be resolved.
And this applies for older people just as much as young people?
Yes. This can be done on children, although I don't see many children, but a lot of older people, you know, mostly the more active 40 and 50 and 60-year-olds, but sometimes older. Still works.
So for people who don't really want to have an operation, this is ideal?
Possibly. It's worth a look.
Yeah.
So if maybe you've been scheduled for an operation, but it might be, 6 months out or even longer, or you don't know when it's going to come along, and you're in a lot of pain and discomfort, you might want to give prototherapy a consideration, because not only can it potentially avoid that surgery, but certainly you'll be in less pain leading up to it.
Thank you, mate. I'm sure a lot of clients will be interested to hear this.
I'm sure they will.